Yay, Sarah Dinkler. Woo, I've been really looking forward to this.
Me too.
Hello, welcome back to The Bleeding Truth. My name's Sally McNally. I'm the Irish midwife.
And I'm Bridget, Sally's daughter.
Today we're very excited. We have one really powerful woman. We have Sarah Dinkler here with us. And she's going to talk to us today about contraception. She has a passion on this subject. And Sarah is a nurse midwife, a women's health nurse practitioner, and she is currently working in Lancaster and delivering lots of babies, I believe. Sarah, tell us a little bit about yourself.
Well, I've been doing women's health mainly for about 20 years. First as a labor and delivery nurse. As you know, this is how we met.
Yes.
Right.
And and then I slowly got to be honest, I became a nurse to become a nurse midwife. So as my kids grew up, I found myself with some spare time between mothering and working to get my nurse midwifery. So I did that.
So much spare time, I bet.
Yes, so much spare time. It was kind of fun because Claire was in high school, so we would go to Starbucks and study together. It was fun.
Oh, yeah.
Some good memories.
I remember those days. I remember. Yeah. Sarah and I worked on labour and delivery as RNs for many years together. We used to have great fun. But she forged the path for a few of us to go in that direction and finish school. Yeah.
There's so many of us now from that unit that went on to get our nurse midwifery.
And I've heard fun stories of you guys on labor ward together.
No, we were always very well behaved. I love this time of year because in my Facebook memories and Google memories that show up on my phone, there's that picture of us with that wreath and we all stick our head through the wreath. So much fun.
Oh my God, I love that.
Yeah. We'll have to find that.
Yes, let's post that, Bridgie. Attach that at the bottom.
Yes, I believe I know the photo you're talking about. But you decided you were always going to go down the nurse midwife path? That was the goal from the beginning?
That was my plan from the beginning. Absolutely.
Where did you first learn about, this career path and what kind of drew you towards it?
After Zach was born, I had Zach with a female OBGYN who I actually really loved and she was wonderful. But I kind of wanted more. I wanted more, especially from the labor and delivery part. So then when I got pregnant with Claire, in the meantime, I had been researching midwives. And when I got pregnant with Claire, I chose a nurse midwife. So at the time, Dr. Fishbein had a midwifery practice in Ventura with Joyce Weckel and Kathy Wingland. And so Joyce delivered Claire.
Oh, I didn't know that. That's cool.
Yeah. And then actually, when Claire was a few months old, I heard from my father, who's a veteran, that I am really sorry, but could you hear my dog?
We can, yeah. If you want to take a second for them, it's okay.
It's so sad.
Maybe if I
they
open
can
the
come
door
in if they, let them in. It's okay.
And when Claire was a few months old, my dad contacted me and he had received total and permanent disability rating from the Veterans Administration. So that made me eligible for some dependent education benefits. But that expires at a certain age. So I had to really crack down and get it done. So thank you to my veteran father for that.
Wow.
That's
great.
Wonderful. Yeah. At what point did you start focusing on contraceptives in your career?
I got very interested in mechanisms of action and stuff like that in school when I took, and Sally, I don't know if you know BJ Snell, but she was actually my teacher at Cal State Fullerton. And she recently passed away, but she is the smartest person I know for sure. Sorry, I have a husky here.
It's a husky, of course. Aw.
Anyway, so I just found it fascinating, and mainly because I had a lot of misconceptions about, and I made some decisions for my own health based on some poor information and some misconceptions about how things work.
Right.
So, and one of those things was the IUD, because I made an assumption on how IUDs work based on my mom's experience with IUDs, which of course was in the 60s and 70s, or 70s,
Yeah.
probably the 70s, right? The Delcon Shield. So,
yes.
with horrible bleeding and pain and
Yes.
So
she had a very bad experience with that, and because of that, you chose not to use one. Is that what you mean, or?
Right. Her perception was that every month she was getting pregnant and having a miscarriage.
Oh, wow.
Yeah.
Because the bleeding and pain was so heavy. But really, we know now
poor
that
girl.
some IUDs, especially early IUDs, are associated with that. So,
right.
Interesting.
We've come a long way.
Yeah, because I have an IUD, and it's definitely not that case.
Yes.
Yeah.
So, thankfully, wow. But that's super interesting. So, like, that kind of motivated you to learn more once you had more knowledge about it. And,
right. Yeah. And then I learned, it actually certain IUDs actually make your bleeding better because there's a little bit of hormone in there, just a small amount. And the other part I didn't understand that I do now, and I try to relay to my patients, is that hormone that's absorbed into your body, it's a local reaction. While there's a very small amount of serum levonorgestrel, it's nothing compared to taking like a pill or something like that. It's a very different level of hormone in your body.
Right.
Yeah.
So Sarah, let's start then with IUDs. Give us a little overview of IUDs that we have nowadays that young women could, think about using or choose from.
Sure. The first thing I want to say before we move there is I have some basic assumptions that I want people to, when they go in and they're like, I need a method. There's some basic assumptions that I want people to think about. And one is like, try not to bring into your mind people's stories, the friend's story or the friend of the friend. Who even knows if that person exists, right? Because there's this, I have a friend who had a friend who had a friend, and this happened to them when they had the IUD or when they had the Nexplanon.
All the time. Yeah.
So the only people I think that are allowed to listen to other people's stories would be, I would think, Bridget or Claire, because they can listen to us because we have this knowledge, right?
Right.
Even if it's your mother, just take it, check it out first with a healthcare professional to make sure it's actually something that you should be concerned about. So that's my first, just try to get that out of your mind. Go into your appointment with an open mind.
Great advice.
The other assumption I want to clarify is that birth control, when you say the word birth control, 99% of the time, someone's going to equate that to the pill. And that's not just birth control is not just the pill. So sometimes birth control is just withdrawal method. That's a method of birth control. So keep that in mind.
Or natural family planning is birth control.
Natural family planning or condoms or whatever. When I'm going into my postpartum rounds in the morning, I'll say, I used to say, what's your plan for birth control? Oh, no, I don't do birth control. And I'm like, I think maybe you do. So let's talk more. I think maybe you do some sort of birth control. So now I've changed how I ask the question. I'll say, what are you going to do in the next year or so to prevent pregnancy? And then I get a much clearer answer. So instead of this wall that comes up because they think I'm trying to push pills.
Yes. Some of my patients will say, well, we always used the withdrawal method. So I'll say to them, how important is it to you within this next year that you don't get pregnant?
Yes,
Between a 0 and a 10, give me a number. How important? And then they
exactly.
might say, oh, it's a 10. So, yeah, then we
Yeah.
try and talk about, what other options might be there.
So when you say also, like, some of your patients don't want to, like, have pills pushed on them, do you feel like there's, like, a negative connotation to taking the pill, or people are wary of it or
In some
something?
cases, someone is just prescribed a pill, perhaps, and then they had some side effects they didn't like in the first couple of weeks, and
So they just
they just stopped
won't
it.
try it.
And then they
Yeah.
equate like that one pill that they took for a few weeks as all pills. There's over 100 different combinations of pills for birth control use. So
Right.
and there's within those pills, there's different levels of estrogen from 10 milligrams to 50 milligrams. There's 4 different progesterones that all have different actions. So there's lots of options for pills. So you can have one pill that makes you feel crummy and another pill that makes you feel amazing. So it's finding a provider that's going to help you find the right pill for you.
Right. You might have one pill that'll help your acne and another pill that'll help the amount of bleeding. Of course, they all do. But that's
I
what
remember
always
trying
I
it for
find
acne.
difficult, because there's so many. There's so
Mhm.
many. And sometimes they come in and they say, well, this is the name of the pill that I take, but it might be a generic name, or there's also different names of the different amounts of hormones. So
Yes.
it can be
How do
big
you
discussion.
like match what type of pill? I'm sure you're not guessing. Obviously, try this
Right.
one. Try this one. Like, how do you? Is it based on, like, blood tests, or
No, a lot of times
I honestly have no idea. Yeah.
I start with a simple question: is like, tell me about your periods. Are they light? Are they heavy? Do they last 2 days? Do they last 15 days? Do you have spotting in between? I have a great book. It's my Bible, called Managing Hormonal Contraceptive Patients. It's by the last name is Dickey, and so he has like charts in there based on, you can look. In fact, I printed one out here. Depending on how their periods are, depending what their weight is, they might do better on one pill versus another.
Right.
There's
Oh,
still a
yeah.
lot of
Right.
wiggle room in there. There are
Yeah.
so many pills, but
I remember trying one for acne for
Oh, yeah.
maybe a couple months at some
Mhm.
point, but it never really helped. And that
Yeah.
was the end of my
yeah.
attempt of using it. And
And the
since
thing
then,
with
I've
acne
had
is
IUD.
it does require a
I believe
not
it,
just
yeah.
a month or two. So
It's I don't know, at least also maybe asking the patient, like, how consistent can they be, because that would probably
Oh, yeah.
have a big role to play in how
Yeah.
effective it is.
Yeah.
I know, like, that's why when my mom started explaining the IUD to me, I was like, great.
Uh-huh.
I can't take the same thing at the same time every day, and trust it.
Right.
Because I
For
would
women
forget,
and women and girls who want to take the pill, I always tell them set their alarm clock on their phone.
Right.
And maybe when they're around a time that they're doing something like washing their teeth.
Right.
And I also tell them have an old-fashioned calendar right there, so that they get their alarm, they take their pill, and they put a little X in. Because I do
sounds
have
so
like some
easy.
really young patients who are like,
Yeah.
I'm bleeding, I'm spotting, and I'm taking my pill. But when we look back in the last month or so, they may have missed a pill. And then it's going to make it look like it's not working and they're bleeding.
Interesting.
Right.
But they're actually having withdrawal bleed before they should.
Yeah.
Another good thing with setting the alarm is never hit stop until that pill is in your mouth. If you
that's
hit
a
stop,
good one.
and you're going to get busy, or if you're like, oh, just stop this alarm because I'm in the middle of something, then you're going to forget.
I'm
So
going to add that.
Always just snooze. Then
Right.
every 10 minutes you'll get a reminder that you didn't do what you were supposed to do. So never hit stop.
I have a small funny story. I knew someone who, like, missed a day, so they thought that if they took 2 the next day, it would make up for missing a day.
That actually
Yeah.
is
Oh, really?
recommend. Yeah, if it's only been
Yeah.
Oh,
one
really?
day, then you can take both
Yeah.
pills as soon as you remember. You take
Well, it didn't work
It
in that
didn't
case.
work. Oh no.
But
But that is the
Yeah.
right. Yeah, you should probably also use a balanced
interesting. Okay.
method, but it is something
Yeah.
to say to do. Yeah.
Oh, poor
But-
puppers.
Oh.
I know. I'm so sorry.
It's
No, you're
okay.
fine. They want to be involved.
You had asked though, Sally, about IUDs. So if we want to circle back there, we can.
Yeah.
Yeah.
I know, Bridget, it sounds like you're pretty happy with yours.
Yeah, I'm on my second one. I did like one for 5 years, and now I'm already in a new one.
Yeah.
And I think that's the Mirena. Does that sound right? I don't remember exactly. But yeah, I had almost like pretty much no issues since I always had very light, this is very personal now, but I'd always had very light periods. So I didn't have very many negative symptoms. And then with it, it's almost like, it's just not a big deal, which is very good. Like I know
so great.
some of my friends, like even on swim team or, colleagues now, it's a big deal every month that, can take some time away from anything else that you're working on.
It's perfect for athletes.
And it really is.
Yeah.
Yeah, I know Bridget was a swimmer and Claire did ice swimming, so
yes, I know. I remember I'd always see her. We'd be at the pool at the same time, and she'd be like doing some. It always looked so fun what she'd be doing, like the synchro. They're so like graceful in the water,
right?
Yeah.
So
beautiful.
Yeah, I remember that. That was fun. Yeah. And diving, didn't she dive as well? Or maybe
no,
I was just doing diving or something.
Not. She might have done it for one summer. Just recreation.
Yeah.
Whatever. But.
We were always at the pool though.
Yeah.
But Sarah, tell us all about IUDs.
Back to the.
Sorry. Yeah.
So there are two basic classifications of IUDs right now. The non-hormonal IUD, which is the Paragard. This is a copper IUD, and it works by confusing the sperm, basically. So they can't swim to, look at me going like this. So they can't swim to the egg. They have no idea where they're going. So, which is great. So that's how that works. And for a lot of people, it's great. So if you have someone that doesn't want the hormones and their periods are pretty normal or average or light, that's a really good option. However, it may cause some increased bleeding during their cycle, but not for everyone. And the longer you have it in, the better that gets. So for people with heavy periods or painful periods, I steer them towards the Mirena, and the Liletta is the other 52 milligram IUD.
Similar one,
yeah.
Okay.
Just different names, same idea. So the second type of IUD is the levonorgestrel IUD, and there are many types. There's the Mirena and the Liletta. Those are both have 52 milligrams of levonorgestrel. There's the Kylena, I think it has 19, and then the Skyla, which has 13.5 milligrams. So, and that's over a 3, 5, or now for Mirena an 8-year period. Mirena is now good for 8 years. So.
Oh wow. Okay.
Yeah.
Maybe
good.
that's what I have.
Yeah, that's what you have. Yeah.
And then I didn't talk about the Paragard. The copper IUD is good for 10 years, FDA approved for 10 years, but evidence says it's good for 12 years or more. So
great.
Wow.
Yeah.
So
especially for women who are sensitive to hormones in any way, or they just choose not to, that's a really good option. Yeah.
I feel, I hope I'm not derailing the topic, but I've heard in the past, and this might be myths, right? That the pill is something that can negatively affect like infertility if it's taken for a very extended period of time.
Oh.
And that's something that I've always been kind of like scared of. Like even just because I don't have the knowledge that you guys have of like how these things work,
Well,
or how
we're
any
both
of the
very happy that you started that out with the myth.
Yeah, we might.
right. And that, because I think I've asked you before and you're like, no, that's not true. But like, it is definitely something that I've heard people be concerned of, because it feels so unnatural to like block that and to, inhibit. So I don't know. Is that something that you would counter? Yeah.
So patients do ask me that all the time.
Yeah.
I'm sure, Sally, I'm sure you get that too. And the key, I think, is what you said, Bridget, when they've been on it for an extended period of time. So when you are 30 years old and you go on the pill for 5 years, you are now 35 years old. And your chances of getting pregnant, are still good.
They're already going down.
Right. Yeah.
Right.
And there's parts you can Google on the internet with regard to fertility as you age, right? So I think some of that could be, I was on the pill for 10 years and now I have infertility. Well, it could be that you're just 10 years older and that's going to affect your fertility.
That's so true. Yeah.
Usually not, but it is something to consider, that it might just be a perception rather than just there's no evidence.
That or just some depending on the patient, sometimes when they get off birth control, some people bounce back really quick and they can get pregnant very fast, and other times it takes a lot longer for things to like go back to normal. Is that also myth, or is
with the pill, you can get pregnant by missing one pill. We've already talked about this.
Right.
With the pill, that no, there's no evidence to support that. With things like the shot, the birth control shot, that can take time for fertility to return, probably about 9 months. So it lasts 3 months, which is great, but it might actually last a little longer than that. So if someone comes to me and says, like, I want to get pregnant in 6 months, I need something in the meantime, I've heard about this shot that's good for 3 months. Maybe I can just get 2 of those. I'll usually try to steer them in another direction and explain that it could take up to 9 months for their periods to return. So,
So that shot, tell us a little bit more about that. What's in that?
The shot is called Depo-Provera. That's the name brand, I guess. It's a progesterone that you get shot every 3 months, and it works by thickening the cervical mucus. It might actually work by inhibiting ovulation as well, because progesterone in larger doses inhibits ovulation. So if there's no egg being released, then you can't get pregnant. So
right.
So that's how
really
that
good.
Yeah.
So less and less people want to use that Depo. Right. I have very few patients that I see that want to.
I just don't hear about it that much. It's not as common, at least.
Right.
If we're thinking about how hard it is to take a pill every day, imagine how hard it is to get to the doctor's office, right? Every 3 months.
Right.
So there can be some barriers there. I love it
That's true.
I like it for giving in the hospital after childbirth. Because I've noticed there's some delay in people getting on an effective birth control method after childbirth, especially in my patient population in Lancaster.
That's so interesting.
They might lose their Medi-Cal, and then they don't know where to go. And then before they know it, because they were on pregnancy Medi-Cal, and then before we know it, they're pregnant again, so back on pregnancy Medi-Cal.
Right.
So some people do that in the hospital before they go home.
Right. Would Nexplanon be an option for that patient, or would that be too expensive?
Is Nexplanon the one that goes in your arm?
Yes. Tell us about Nexplanon.
So Nexplanon is also a progestin-based contraceptive. That's an implant that goes in the arm. Mm-hmm. It's expensive and difficult to stock, so that's I think it's perfectly fine to do right after childbirth. That's not the issue. I think the issue is the hospital's not going to have it in their
access
in their Pyxis system, right? Whereas the
Depo, they have it.
They have it.
So
Great.
interesting.
Yeah. So the progesterone only forms of contraception, they're really good choices for women who've just had a baby, especially if they want to breastfeed. Because if you give them an estrogen form of contraception, it can reduce their breast milk just a little bit. Is that true,
Right.
Sarah?
That is true.
Yeah.
Oh, wow.
Yeah.
So that is something to consider. Yeah.
Yeah. So we want our women who are listening to this to have the bleeding truth about contraception, right? So
Literally.
yeah, the
Literally.
bleeding truth.
Patterns.
So then, just to recap that, then your
Mhm.
forms of progesterone only would be the depot shot, which you'd have to get every 3 months.
Mhm.
You could have a Nexplanon implant, and how long does that last, Sarah?
FDA approved for 3 years, but again, the evidence on the Nexplanon says it's probably good for 5 years. So nothing
Right.
magically happens at 3 years in one day, right? It doesn't just
Right.
self-destruct in your arm, or same with the IUD. Nothing happens at
Yeah.
5 years in one day. So
Right.
They always estimate like a year or two
Less.
less
Yeah.
than
Yeah.
just to be safe.
So you have the shot, the implant, and the IUD forms of progesterone only. For you women who've just had babies, they're really good options.
yes.
And then
And there's the pill.
And then, of course, oh yes, there's the pill, the Micronors, the mini pill. It just has one hormone, the progesterone.
Right.
Yeah.
And there's a new pill called Slind that's also a progesterone only pill, but it's not a generic, so it's not going to be at a price point that everyone can afford, probably. It has a little bit of a longer half-life, which is great, which means with the progesterone only pill, traditionally that's been out there, is you have to take it like pretty close to 24 hours, or you might have some unscheduled bleeding. So with Slind, it has a longer half-life, so there's a little bit more wiggle room there. So people like that.
Great. So then we have hormonal and non-hormonal. Do you know of any more non-hormonal that women might use?
Well, especially for our well, obviously condoms. And that's another thing. That's another thing
Yeah.
to put out there when we're talking about contraception, is the only thing that's going to prevent sexually transmitted infection is a condom, female or male condom. That's it. Everything else, you have to use a condom if that's a concern for you. So if you're not in a relationship where you can necessarily trust your partner, or if you're, then you need to use a condom, which is going to increase the efficacy of your birth control in the long run.
Yes.
So
Yeah.
Um,
Fantastic.
for our breast, since we were talking about breastfeeding moms, new moms, there's that FQHC gel, which is
I've given it to a few women, and they seem to like it. Yeah, they seem to. For the ladies who definitely don't want a hormone, tell us about FQHC, Sarah.
Yeah, I have never heard of this.
Okay, so I have to, little disclaimer, when the market took a big crash, I bought probably, I don't know, a few dollars shares worth of FQHC. So I'm not, so a little disclaimer. I own a couple of FQHC shares only because I believe it's EvoFem is the company. Only because I believe in this as a method, because I think it does a lot to kind of empower women in a lot of ways that some other birth control methods don't. So for new moms, it's great because you're so exhausted and you're probably not having sex 3 times a week, right?
Yeah.
You're probably just in general. So all you need to do is use the applicator, put it in up to an hour before intercourse, and you have some protection. Now, it's definitely not, 99% effective like an IUD or an implant, but if you're a new mom and you're in a relationship, a committed relationship with a partner, then that's probably
Right.
Okay.
And you have that
Enough.
option that you can say, hold that thought for an
Yes.
hour.
Yes. Yes. And that's something to consider. So if you do get interrupted with, the baby starts to cry and you get interrupted and you have to go deal with that. And then you come back. If it's been more than an hour since you put it in, you have to re-put it in. So you might
Good. Yeah.
have something to
Interesting.
Yeah. Yeah. You have to put a new application in.
And is it designed just for like postpartum, or is it something
No.
that anybody could use?
Oh, anybody could use it. And the way it works is just it acidifies the vaginal canal. So it's called a pH modulator, and it
Right.
so it makes it inhospitable to sperm because it's so acidic. So.
It's like the spermicidal that people used to use years ago. I don't hear so many women talking about spermicidal, but it is like that.
Well,
but way more effective.
No, the problem with spermicide, like nonoxynol 9, is it's actually very bad for the vaginal walls. Yeah, and it can increase your risk of infection, like HIV, if you use nonoxynol 9. So, so it's caustic to the sperm as well as your vaginal health, whereas the Phexi doesn't have that same problem. So.
It's friendly to the vagina.
Friendly to the vagina, yes.
So that's a good option then for people.
Yeah.
And Sarah, lately I've met so many young women who are studying their own fertility, and I really think it's so great. When I was in midwifery school back in Ireland, the nuns gave us all the first day of midwifery school. They came out with this chart. We all got a big chart to stick up on the wall, and it was 24 months and a bunch of these stickers. And if you had a period, you had a little red baby sticker. And if you had mucus, you had a cloudy baby, and then you had a clear baby for ovulation, and then green stickers for in between. And we all studied our fertility like really, really well. We had this chart and we got to watch it. And honestly, for most of the 2 years, I was so clear on when I was fertile. And I knew exactly when my period would start. But just a little interesting story. My sister had a sudden infant death. And she went through a lot with that. And I was very involved around that time. And so I was kind of stressed about the situation. And I didn't ovulate that month. Wasn't that interesting?
Yeah.
So I always remind women who are studying their own fertility to watch for things like stress, and illness.
Big life changes, I've always gone thrown off, periods. Right. Every time I move or I'm stressed for a long period of time.
Yeah. But I thought it was a great idea. I wish that young women could get that, but they laugh at me when I tell them about my old-fashioned chart because now they have their apps. They do it all on their app.
Right. Yeah, so with natural family planning, it works really well if you have regular periods. If you don't, if you have irregular periods, then it's not going to be as effective, and you might find yourself quite baffled and confused as to why this works for people because some people's periods are anywhere from 21 to 3 months, 21 days to 3 months apart. So it's harder for those people. But if you're someone who has a 27, 28, 30-day cycle, then it works really well. And you, like you said, like getting to know the cervical mucus, I think that's what you were alluding to, the clear babies.
Yeah. Right.
Getting to know your cervical mucus. If you have that egg white cervical mucus, you are likely fertile during that time. If you're using a IUD that has progesterone in it, though, that's going to thicken that cervical mucus. So you might not notice anything.
You won't be able to tell.
Any progesterone method. So you're unlikely to know. So, yeah.
So tell us about the temperature method. That would tie in with that too.
Oh, yeah.
Yeah, it does tie in. I mean, you can do these elaborate charts. So there's after ovulation, there's a spike in your basal body temperature. So some women will track their temperatures every morning, and basal body temperature just means that temperature that you take before you move out of bed in the morning. So first thing in the morning, you take your temperature and you chart it or plot it on a graph, and you'll notice that probably day 12, 13, 14, you're going to start seeing that slippery mucus. And then in a few days, you'll see that spike, and that means you've ovulated. You'll see that spike in your temperature.
Wow.
So beyond, after that temperature spike, if you're trying to use this to prevent pregnancy, then you're good to go till your next period. Then you don't have to worry about any contraceptive method if you're following this perfectly. So that's the caveat.
I always tell the women around that 12-hour window where you're like really, really fertile, a few things might happen. That mucus comes and it looks like egg white and it's strong and stretchy, you can see through it. And you feel kind of open down there. Like when you're going to the bathroom, it feels kind of open. When you wipe, it's really slippery.
Mm-hmm.
And then when you look at your partner, they look so handsome. Right? Like, oh my God, they look so good. Oh, and you might get a little pain on one side or another.
Right.
Yeah.
I guess, and I think there
Johnny's handsome every day.
Oh, I was going to say the same thing about my husband.
Oh my gosh.
Ovaries are wonderful, aren't they? Ovaries
They're very interesting. Ovaries are interesting.
Bridget, I think you came from my left ovary.
I know, you always say that.
My Democrat one.
Oh, you're hilarious. And if I was a boy, I'd be Liam, right?
Yes. My fibroid is Liam. I have a fibroid called Liam.
I remember you calling your fibroid Liam.
Yeah.
I had the fibroid a long time.
I have. Oh, my little friend.
Oh gosh.
Anyway, so Sarah, is there any other form of birth control that you could advise people about?
Well, another one to think about for new moms is, lactational amenorrhea, which is,
yes.
So basically if you're exclusively breastfeeding, and unfortunately this doesn't work for people that are pumping and giving milk that way, because you really need the baby's stimulation of the nipple for this to work. But if you're exclusively breastfeeding and you're feeding at least every 4 hours, if your periods have not returned, then you likely have protection for that first 6 months after the baby's born. But if you're supplementing or pumping and feeding, or if you've already got your period, or your baby's sleeping like 7 hours at night, God bless you, then it's not going to work as
right.
So,
right.
But
yes.
That's one, and there's this also patches and rings to talk about if you want, or we could go into those.
What's the ring?
There's a vaginal, there's two, I think, vaginal rings now. They're a combined hormonal contraceptive. So they have both estrogen and progesterone in them. And you basically insert it in the vagina and it just lives there. One of the rings you replace you put it in for 3 weeks and then you take it out and have a period. And then after a week, you put a new ring in, and then there's another newer ring that's good for an entire year. So you put it in, take it out, you store it during your period, and then put it back in after a week. So
and that's something that you could do all on your own, or do you need to go in?
Those require prescription, and you need to be a candidate for you need to not have any medical conditions, kind of like with the pill that would be contraindicated. So,
But each
Gotcha.
time you're changing it out, you can do that on your own. It's
oh
easy.
yes, is
Yeah.
that what you were saying?
Yeah.
Yeah, no, but
Is
you
that-
informed more too.
yeah, but you do need a prescription. Yeah, absolutely.
Yeah.
You just put it in yourself, take it out
Mhm.
yourself.
Interesting. Yeah.
Yeah.
There's
I
a lot more
haven't.
that I
Oh,
didn't
sorry.
hear about before. Yeah.
Yeah.
Go ahead.
I haven't come across a lady in the practice wanting a sponge. Tell us about sponges. I don't know a lot about them.
Are they still manufacturing the sponge? I'm not sure.
I don't
I don't
know. I've
think
never had to give it to anyone, so I've
I
never
don't
had
think
to.
they are, because there was that whole Seinfeld episode where they took the sponge off the market, right? And Elaine was talking about if somebody was sponge worthy to or something like
To use up her sponge.
sponge. So I'm
Oh,
not
that
too
was funny.
familiar about the sponge, but yes, there is
Right.
a sponge that you can. And it must be saturated with nonoxynol 9 or something.
Yeah.
I
Yeah.
think.
But hopefully women listening to this might, choose a different option, something that might be a lot easier.
Or just do more research, because
Yes.
I mean, again, I'm lucky to have you as a resource, but I didn't know that there were so many options
Mhm.
at
Yeah.
all. Like
Yeah.
only
Yeah.
through talking about it you
But the
get exposure
only
to
option
that.
that's like 100% proof that will keep you not pregnant is abstinence.
Sure. Until
Right, that's the
you're no longer
100%.
abstinent.
I think
Maybe
we
it should
had
be.
some form of sex education, and it was like abstinence. That's the one. That's
Yes,
what the nuns used to teach us.
the Catholic,
Don't look at a boy. Don't talk to a boy. And
right?
then we'd be like, a boy. There's a boy.
It's almost like
Made us
the
crazy.
forbidden fruit, right? They made it work.
Yes, the forbidden fruit. Exactly, Sarah.
Don't touch that,
Yeah.
whatever you do. Yeah.
And I just kind of want to touch on the topic just briefly of like abortion, because I don't personally consider that like a birth control, but it is something that kind of is also within this like breadth of women's health as well. I don't know if you have any like thoughts on that as like a resource in this area too, or any things that you would share on that topic as well that you feel comfortable talking about. Right?
Yeah. Well, first of all, I would say if you find yourself in a position where you've had unprotected intercourse and you're thinking, I shouldn't have done that, or I wish that hadn't have happened, because it's not always that you did something. You have to get yourself to a healthcare provider or the pharmacy, because you can get Plan B at the pharmacy without a prescription. There's a couple of different morning after pills that can be prescribed. And there's also the copper IUD can be used as emergency contraception as well.
Really?
And the benefit to that is now you have a really good method of birth control as well going forward.
Right.
So,
right.
That's nice. So that's the first thing people need to know, is that there are ways to reduce their chances of getting pregnant after the fact.
Right.
Specifically, the morning after pill works by, or at least Plan B works by delaying ovulation by a few days. So that can mean that the sperm will die out, and then you don't have to worry about an egg.
Are there any like risks associated with Plan B? Just, I've never had to use it, but I've heard like kind of the same. Is it a myth, or is it true that it can also just be not healthy to use? I'm not sure.
Well, it's certainly going to be more healthy than a pregnancy that you're not ready to
prepared for.
No, I mean, it's a progesterone only thing. So it might screw up your cycle a little bit. It might cause some bleeding,
Gotcha.
some irregular bleeding, but there's no, cardiovascular issues or stroke
Right.
concern
Okay.
or anything like that because there's no estrogen in it. It's just a hefty
Gotcha.
dose of progesterone to delay ovulation. And it's
Okay.
really designed for people with a normal BMI. So it's going to work best on a person with a normal BMI.
Yeah.
If you're in an overweight category, then the IUD is going to be a better bet for you, the copper IUD. So.
Great.
Super
Fabulous.
interesting.
Yeah.
Yeah. So on the topic of abortion, though, my biggest concern is just the misconceptions that are out there with regard to, especially things like IUDs. People do have a misconception that they cause abortion, and that
I've never heard that, thankfully. So
we have.
Yeah, it's out there. Some of our legislators in some of the states think that that's how they work, and it's just simply not true. Yeah. So we already talked about how they work. The copper one confuses the sperm, and the progesterone one thickens the cervical mucus so the sperm and the egg can't meet. And it really is that simple. So my concern is that some of these legislators getting into office are going to try to outlaw these really excellent birth control methods or make additional barriers for women.
Yeah.
And I think it's a real concern.
Yeah.
Yeah. That would definitely be a problem because it's great that we have the option to, get those resources and, not come to a point where you're not prepared.
Right.
But also, I think before all of that, just educating is the first starting point of birth control. So,
talk about
not going down the wrong path or something.
Yeah.
And I think it's great if women come in to discuss birth control so that they know their options. They might never have heard of half of what we're talking about. Sarah.
Yeah. Right.
Yeah. So there's lots of options, as you've just heard, and someone will pick one over another. Sometimes I'm like baffled why, somebody would want something like a female condom, right? But it's such a good barrier, right? So tell us a little bit about that, Sarah. Go back to the female condom.
The female condom is probably better at well, first of all, anything that gives the woman the control, I'm a fan of.
Yeah.
That's why I like. Yeah. That's why I like. So it'd be hard to, have you heard of this stealthing, right? Have you heard of this?
No.
Like stealthing, like having sex with someone, saying like probably more of a casual sexual encounter where the man takes off the condom in the middle of the course. And I think it's called stealthing. So
where they are just not, honest about their contraceptive, basically. So somebody might be at risk of getting pregnant. Is that what that means? Or?
Right. So the man they agreed we're going to have sex, but we do it with a condom. And then halfway through intercourse, he is able to take it off somehow. And now they're having unprotected sex. So now she's at risk for sexually transmitted.
And she is unaware. She's unaware that she's having
unaware. Yes.
Whoa.
So this is
I'm sure that happens.
So that's why so it'd be harder to do that with a female condom, obviously.
True.
That's why I like Phexi, the idea of Phexi, because she has the control. She can put that in before the encounter, and then if something like this happens, or even if the condom breaks or whatever, then she has that extra layer of protection against pregnancy. So
very good.
What the original question was.
Yeah.
Oh, the female condom.
No, that answered it though.
But that did.
Yeah. It's an extra layer of protection.
Yeah,
and it gives her it gives her control. I think it's more awkward to put in, so not everybody is comfortable with that. And it also helps a little bit protect more of the labia from infection, which is good. Um,
Right. Yeah.
yeah. But not
This
not
is
a
super
terribly popular
interesting.
method, though.
No, not at all popular.
Yeah.
Um,
But
so
always
just
an
to
option.
bring you back to OCPs,
Mhm.
so some women think that they cause cancer,
Oh yeah, yeah. So
and of
there
course this
are,
isn't true.
yeah. There's actually a lot of good evidence that birth control pills actually reduce a lot of female cancer. So reduction in
Yeah.
ovarian cancer, reduction in
Mhm.
endometrial cancer. Um, I think there's even a reduction. I don't quote me on this, but I want to say gastrointestinal cancers, but I'm not sure if that's true.
Uh-huh.
I might have
Yeah.
it written down somewhere. But there's actually a lot of good.
Yeah.
Maybe the only one is breast cancer. There might be a slight increase, but
Mhm.
still, compared to the risks of pregnancy, um, you still have a good. There's still a good risk benefit profile to taking a birth control pill.
A lot of my patient population are, late 30s, 40s, and they will uh, go from taking contraceptive pills right into their menopause, where they then switch to hormone replacement therapy. So
Yeah.
they spend big chunk of their life taking hormones. Yeah.
Yeah,
I'm sure you've come across that, Sarah, too.
I have. Yeah.
Yeah.
I think,
Yeah.
I think if for the person, everybody's different. So for the person that wants that, that's great for them. I'm happy for
Yeah.
them. So
Mhm.
Yeah.
yeah,
Right.
and they have total control of their, fertility, their
Mhm.
menopause, all of those symptoms. So good for them.
Right.
Yeah.
Yeah. And then another myth that I've come across also is that a person with the fibroids that bleed a lot and stuff, that
Mhm.
they cannot have an IUD. And
So
that's not true.
that's not true. Yeah. So
What
Mirena
is
is
what
actually,
is a fibroid?
we
What
have
is
to
Liam?
good, good call.
Well, fibroids like a little growth that can happen on some part of the uterus. Sometimes
Mm.
it's coming into the uterus, sometimes it's in the wall, sometimes it's on the outside part of the uterus.
Okay.
But they can bleed a lot during your period, and sometimes they can cause pain. Sometimes they grow bigger, sometimes they stay the same. And a lot of women might have a little fibroid of some sort. So they
And not
can,
know it. Just think it's
and
period or.
yeah, but it's not a cancerous growth
Mm.
usually. And whereas before, a lot of women would have them removed surgically. But some women now can opt to have an IUD, a progesterone only IUD, that seems to help really well, I think.
Yeah. So as long as the uterine cavity is not significantly distorted by the fibroid, then a
Yeah,
Mirena IUD is actually FDA approved for fibroids as well. So
yeah.
to help with the symptoms and might help actually shrink them a little bit as well. So yeah, that's a really good point.
Uh-huh.
I
So
feel
there
like
are
I've learned a lot.
yeah.
Every time we do an episode, I'm learning
That's
more
so
things.
great.
So
I love that.
And that's why you really need to have a one-on-one discussion with someone who's willing, a healthcare provider that's willing to really go through all these things.
Yeah,
Because not one method is right for everybody. It really is
right.
Mhm.
absolutely individualized care. My bleeding truth
Yeah.
with regard to contraception
Yeah.
is I if I had understood, this was before I became a nurse and before I
Mhm.
understood what I know now, but if I had understood about really how IUDs work, I might not have chosen sterilization as a method as early as I did,
Oh,
if that
Oh,
makes sense.
oh,
wow.
So,
yeah.
so that's my bleeding truth is that I have 2 children and I love them, but my life might be a little bit different had I been like, let's try this IUD for a few years and then see, are we really done having children?
Wow.
Right?
Oh, yeah,
So
that you
Right.
may have had another one. Yeah.
So
maybe. maybe not.
Yeah. But you would have had
But to
that
have the
choice.
option. Yeah.
Oh,
Yeah, maybe. So that's why I really do encourage people to really
Yeah.
put behind them like stories they've heard, other people's experiences. They're all going to be very different than your own. So yeah, you got to come in with an open
fantastic.
mind for sure.
Absolutely.
Fabulous.
Well, thank
Thank
you for
you
sharing
for
that
that.
as well.
Yeah, because of course that's the ultimate birth control right there, is to have your tubes tied, or to have the partner's tubes
Right.
tied.
Yeah.
Mhm.
Yeah, I mean, it is considered permanent sterilization. I mean, it is considered a
Yeah.
permanent birth control method. There's still a failure rate, and actually, the Nexplanon is actually about the same.
Safer.
It's about the same efficacy.
Wow.
I think it's like 0.3% for tubes tied and 0.2%
For Nexplanon.
for Nexplanon.
That's funny.
Yeah.
Wow.
So it's actually, Nexplanon's a really good method as far as
Wow.
efficacy is concerned. But
What a lot to think about, huh?
yeah. And each one of these little subjects is probably each one of these methods is probably a podcast.
Yeah,
on its own,
I
right?
agree.
Yeah, I really appreciate getting to see you again. It's been a long time.
Yeah, me
Great to
too,
see you,
Sarah.
Bridget.
Yeah, say hi to Zach and Claire.
I
from me.
will.
And for anybody still listening, please make sure to give us a like and subscribe. If you're listening on Apple, please hit, a review for us. That would always help. And we'll definitely bring some more great episodes like this down the line. So thanks again, Sarah.
And thanks for sharing your bleeding truth with us, Sarah.
Yeah.
So
Thanks for having
interesting.
me. I love
Thanks
it.
a million.
Thanks a million. So thanks again for listening. We really appreciate it. And if you like what we're doing, give us a bit of a review on Apple. That would help us so much. And if you come across a subscribe button, press the subscribe button. It doesn't cost you anything.